we love this conversation. We have it every day. There's a really good tool that our friends in the American Heart Association use that we like because it's interrelated. Each component has an impact on another component. It's called Life's Simple Seven, and it looks at how you can take control of many healthy variables in your life and adopt them for long-term success. We know that blood pressure is incredibly important, and some of the guidelines that Dr. Mike and some of your physicians out there are adopting change. They changed in 2017 and became a little more aggressive to help your providers set a blood pressure goal for you that can help you live longer and feel better. So we want you to understand your blood pressure, understand diet and exercise's role in blood pressure. We want you to also to know your numbers, what those numbers mean, as far as blood pressure, cholesterol, blood glucose, whether you're a diabetic from birth or maybe it developed later on in life as an adult. We want to help you understand what your target should be and how you can get there. Maintaining all those numbers in an ideal range gives you a better life expectancy. We know that exercise is incredibly important. Now, exercise too can also be really confusing. Like you talked about, you walk into a gym, you see a lot of equipment that may sometimes look more like torture equipment than exercise equipment, but it's all about finding what works for you. And what we often find is simple fundamentals, lifting some weights, but getting some aerobic activity. If you like it, you're going to be more likely to do it almost every day, which is what we want. We want to see you compliant with it for the long term. When it comes to diet, it's almost as confusing as exercise. What to eat, what's good, are eggs in favor, are eggs out of favor? There's a lot of confusion, but what we find is there's some fundamentals that are really important to adopt and master if you can. Eating a lot of vegetables, a variety of vegetables, colors, setting up your plate appropriately, snacking healthy, all this to perhaps lose a little bit of weight. We know that weight not necessarily is a singular figure that we should focus on, because being overweight does not necessarily mean you're unhealthy, and then being an appropriate weight does not necessarily mean you're healthy likewise. But as Dr. Mike also talked about, stopping smoking, that is one of the most powerful but often difficult health variables that we want to help you get control of. There's a lot of research out there. There's a lot of support out there. And professionals like us and Dr. Mike, we want to help you be successful in tobacco cessation completely.